Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1. Extract 1. Questions 31 to 36. You hear an interview with a doctor. You now have 90 seconds to read questions 31 to 36.
Today we are speaking with Dr. James Taylor, a pulmonologist in the USA who specializes in black lung disease. Dr. Taylor, could you explain what black lung disease is and how it affects individuals?
Black lung disease, also known as coal workers' pneumoconiosis, is a lung disease caused by prolonged exposure to coal dust. It is characterized by inflammation and scarring of the lungs, which can cause breathing difficulties, coughing, and chest pain.
Who is at risk for developing black lung disease, and what are the potential causes of the disorder?
Black lung disease is more common in individuals who work in the coal mining industry, and the risk increases with the duration and intensity of exposure to coal dust. Other potential risk factors include smoking and underlying lung conditions such as asthma or chronic obstructive pulmonary disease, COPD.
How is black lung disease diagnosed, and what treatments are available?
Black lung disease is diagnosed through a combination of medical history, physical exam, and imaging tests such as chest X-rays or CT scans. Lung function tests may also be performed to assess breathing capacity. Treatment options may include medication to manage symptoms, oxygen therapy, and in severe cases, lung transplantation.
Can black lung disease be cured, and what impact can it have on a person's quality of life?
There is no cure for black lung disease, but with appropriate treatment and management, many individuals with the condition can manage their symptoms and lead meaningful lives. The impact on a person's quality of life can vary, depending on the severity of symptoms and the response to treatment.
Can you share a case study of someone who has been diagnosed with black lung disease?
Yes, I recently treated a middle-aged man, let's call him John, who worked in the coal mining industry for several decades and was experiencing breathing difficulties and chest pain. We performed a medical history, physical exam, and imaging tests, which confirmed a diagnosis of black lung disease. We prescribed medication to manage his symptoms and also recommended lifestyle changes such as quitting smoking and avoiding exposure to environmental pollutants.
What advice do you have for individuals who work in the coal mining industry or other high-risk occupations?
My advice would be to take appropriate precautions to prevent exposure to environmental pollutants, such as wearing protective gear and following safety protocols. It's also important to undergo regular medical checkups and screening for lung conditions such as black lung disease, as early diagnosis and treatment can improve outcomes and prevent complications. Finally, seeking support from community resources and support groups can be helpful in managing the emotional and physical challenges of living with black lung disease.
Thank you for sharing that insightful information, Dr. Taylor. Could you explain how the symptoms of black lung disease progress over time, and are there any warning signs that individuals should look out for?
The symptoms of black lung disease can progress slowly over time and can vary in severity. Initially, individuals may experience a mild cough and shortness of breath, which can worsen with continued exposure to coal dust. As the disease progresses, individuals may also experience fatigue, chest pain, and respiratory failure in severe cases. Warning signs of black lung disease can include persistent cough, shortness of breath, chest pain, and fatigue. It's important to seek medical attention if any of these symptoms occur, especially if you work in a high-risk occupation such as coal mining.
Are there any preventative measures that individuals can take to reduce their risk of developing black lung disease?
Yes, individuals can take several preventative measures to reduce their risk of developing black lung disease. These include using protective equipment such as respirators and dust masks while working in dusty environments, taking regular breaks to avoid prolonged exposure to coal dust, and practicing good hygiene to reduce the amount of dust that is inhaled. It's also important to undergo regular medical checkups and lung function tests to monitor for early signs of lung damage. Quitting smoking and avoiding exposure to other environmental pollutants can also reduce the risk of developing black lung disease.
What are some common misconceptions about black lung disease that you often encounter among patients?
One common misconception is that only individuals who have worked in the coal mining industry for several decades are at risk of developing black lung disease. However, even short-term exposure to coal dust can increase the risk of developing the condition. Another misconception is that black lung disease is a condition of the past and is no longer a significant health concern. However, despite improvements in workplace safety and regulations, cases of black lung disease continue to be reported, and it remains a serious occupational health issue.
What advice would you give to family members or loved ones of individuals with black lung disease?
Family members and loved ones can play an important role in supporting individuals with black lung disease. This may involve helping with daily activities, providing emotional support, and encouraging individuals to maintain a healthy lifestyle and adhere to their treatment plan. It's also important to educate themselves about the condition and its management, as well as seek support from community resources and support groups. Overall, a supportive and caring environment can greatly improve the quality of life of individuals with black lung disease.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a talk given by a healthcare professional. You now have 90 seconds to read questions 37 to 42.
Ladies and gentlemen, I stand before you today to discuss a condition that many of you may be unfamiliar with: lichen sclerosus. Lichen sclerosus is a chronic skin condition that is more common in women than men. It most often occurs in the genital and anal areas, but can also affect other areas of the body. Despite the relatively common occurrence of lichen sclerosus, it is often underdiagnosed and undertreated, causing significant distress and discomfort to those affected. Lichen sclerosus is a chronic autoimmune condition that affects the skin and mucous membranes. The exact cause of lichen sclerosus is unknown, but it is believed to be related to genetics, hormones, and immune system dysfunction. Symptoms of lichen sclerosus can include itching, pain, burning, and scarring. The skin may become pale, thickened, and wrinkled, with a shiny and smooth appearance. In the genital region, lichen sclerosus can cause fusion of the labia and clitoral hood, resulting in significant sexual dysfunction and discomfort. Lichen sclerosus can be diagnosed through a physical exam and a biopsy of the affected area. If you suspect that you may have lichen sclerosus, please see your healthcare provider. A timely diagnosis and treatment can help to prevent scarring and improve the overall quality of life for those affected. Treatment for lichen sclerosus may include the use of topical corticosteroids, which can help to reduce inflammation and itching. Non-steroidal creams and ointments may also be prescribed to help with symptoms. Conservative treatments such as wearing loose clothing and avoiding irritants such as soaps and perfumes can also help to reduce symptoms. In severe cases, surgery may be required to address scarring, fusion of the genital tissues, and sexual dysfunction. Timely treatment is critical in preventing complications such as skin cancer, which are more common in those affected by lichen sclerosus. If you have been diagnosed with lichen sclerosus, it is important to maintain regular follow-up and monitoring with your healthcare provider. This will help to ensure that any changes or progression of the condition can be addressed in a timely manner. Ladies, it is especially important to be vigilant about any changes in the appearance or function of your genital area. Regular pelvic exams and skin checks can help to identify any abnormalities early on. Your healthcare provider can also provide education and resources to help reduce your risk of developing lichen sclerosus and other genital conditions. Now, I would like to share with you a case study of a patient who was diagnosed with lichen sclerosus. This patient, a 42-year-old woman, presented to her healthcare provider with complaints of intense itching and burning in the genital area. Her healthcare provider performed a physical exam and took biopsies, which revealed lichen sclerosus. The patient was prescribed a topical steroid cream, which she applied daily for several weeks. She also made lifestyle modifications, such as wearing loose clothing and avoiding irritants in the genital area. After several months, the patient reported significant improvement in her symptoms and her skin appeared less pale and thickened. Current research in the field of lichen sclerosus is focused on developing more effective treatments and understanding the underlying causes of the condition. Some studies suggest that lichen sclerosus may be related to imbalances in the microbiome within the genital area, and research is ongoing to investigate the potential role of probiotics in preventing and treating the condition. Future directions in the field of lichen sclerosus include increasing awareness and education about the condition, as well as developing more personalized treatment approaches based on patients' individual symptoms and genetics. It is important for healthcare providers to stay up to date on the latest research and treatment options for lichen sclerosus, in order to provide the best care possible for their patients. In conclusion, lichen sclerosus is a chronic and often underdiagnosed condition that can greatly impact individuals' quality of life. It is important for individuals to be aware of the symptoms and risk factors, and to seek medical attention if they suspect they may be affected. With proper diagnosis and treatment, those affected by lichen sclerosus can experience significant improvement in their symptoms and overall well-being. Thank you.
That is the end of part C. You now have 2 minutes to check your answers.